Hi, ladies. Ann Baker back here again with you, giving you a 30-minute, more or less, video, some yoga and Pilates-based moves to give happier hips. Hips meaning the joint and the musculature around the pelvis, not just the bone up here, the hip bone or the waist, although they're all important because there's a lot of muscle, powerful muscle that connects your legs to your spine, your pelvis to your spine, around your hip. Lots of muscle and power. Okay, so props that you'll need: something for your head, some type of supporter pillow, perhaps your mat, and a stretchy band. Okay, or a band of some kind that has some give and can create some tension. Okay, so you put that aside. Come into lying. Just move my mat around a bit. And as always, getting a sense for your breathing. If your hands settle on the rib cage, and we have an inhale through the nose. Start to looking for that expansion of the ribs, not just the front and not just the belly, but the back of the rib cage, all the way up to the chest, like a puffy down coat. And the exhale, letting those ribs draw in and the breastbone soften. All right. Now the breath does affect when you inhale again. That diaphragm descends, and this is important for a hip, that the diaphragm drops down and the contents of the belly expand, and the floor of the pelvis drops and then draws up, and the belly draws in. The ribs close a bit. Now your belly in the front is just the front of your lower back. So when you breathe in and you're expanding the rib cage and the belly, it's also the lower back, even down into the floor of the pelvis. Although you might not feel that, the belly will pull in on your exhale and the ribs will pull in. The thing about the breathing, as you take one or two more, is that the tissues of the diaphragm are connected to our hip flexor tissues. Okay? There's a continuum. So the breathing is really important for happier hips. Okay, so getting that feel for the breath and where it's moving in your body. Okay, I'm going to take my pillow out, stretch out one leg, I'll say my left, see how the front of the hip feels. Take a quick peek to see if the leg is straight. And then let the other leg come up, but not with my hands. I want to see what I can do. It might come up, it might not. And then I'm just going to hug that leg in. And let it come back down and slide out. Okay. Bring up the other leg, the left one. Make sure the right one is straight because it's not a lot. When I do that, I'm going to push through my heel to get a little bit of my right hip. And then I'm going to bring this one in. Okay. So not excessively, I don't want to have to turn, okay, or lose contact with my opposite side. And then stretch that out. Okay, and bring the right one up again. So the left one's getting a bit of length, but my pelvis is not rocking. Push through my left foot. Bring the hands in. And if you'd like, we'll just take the nose and tuck it down. And you can curl towards, and you might feel a bit more of a pull through here, a bit more belly support needed. Back down. And take my left hand to my right knee. Okay, and do a gentle twist. Nothing excessive. And start getting into the outside of the hip. You could put your hand on your head, or you can take this opposite hand to the floor somewhere comfortable. Breath into the rib, belly, lower back. And come back out of that gentle twist. Right leg goes out. Left leg comes up and in. Right foot push. Hands to the back. If you'd like, knot the bridge of your nose and curl so the weight's on the bottom of the ribs. They're all connected. And down we come. Okay, letting the leg move down a bit if that's easier. I'm going to use my right hand on my left, outside knee. And just go far enough that I start to get a sense for this side. Okay, around the hip, down through the ribs. Taking a breath in. Expanding the back, not just the front. And come on back. Okay, bring the feet down. Okay, push the feet into the floor. Push the hands and the shoulders back. And lift the hips. Okay, try to keep the ribs from pushing up, out in front. Okay, so that might not happen right away. You might not get that high. We're looking for a little bit of lengthened feeling. We're going to drop and then lift. Take a breath in with my arms coming up. Reaching back toward the floor. And bringing the arms down. And I'm going to roll down through my spine. Good. And do a little bit of pelvic tilting backward and forward. Ideally, it's just the bones of the hip. Okay, it's not the ribs going up and down. So see where you're starting with that. It might work, it might not. Okay, and then you bring your legs together. So knees are touching and feet are touching. Arms out, palm down or palm up. Okay, and we're stack the legs and turn. And again, get this outside hip. Okay, there's a little more of my upper back coming off the floor here. Shoulder blades ideally don't. Okay, pull back with the side that's to the ceiling. Squeezing the legs. Let's go the other way. Revolved abdominal pose. Okay, coming into this side lateral part of the hip. And then let's do that again. Over we go. Squeeze the legs together. And squeeze them particularly on the way up. Belly in and over. Squeeze them together. Over you go again. Breath in. Exhale, belly in and back. Okay, move your feet wide apart and let's do the same thing. Okay, feel for the legs. As we turn to the left, your left leg will fall, turn, rotate out, and the right leg will turn in. Okay, or it might not feel that way. Don't press too heavily through the knee. I don't want to hurt the knee. I'm going to roll back to the center and over to the side. And roll back through center. Just easy breathing. Feeling the hips turn, the legs turn, the hip bones and the leg bones, and how there's some rib and spine in there too. Back to the center. And over. One more to the other way. Over. Roll the hips back. The ribs are coming back. And the legs. Right leg up. Classic. Figure. Okay. Try not to flatten your back or arch your head. Okay. Leave the head pretty neutral. And bring the legs towards you. Just test it out. See how the right hip, left hip feel around the buttock. And come down. Okay. Other versions of that. Maybe this is enough for you. Maybe you can just bring your foot in and get a good stretch. We also have the lifted version with the hamstring stretch added. Could be a bent knee as well. And sometimes people put the hands behind the legs. So try that out. See if you get level. I was way over on my right side. And then down. Down. Before we do the other side, hands down. Little gap in my lower back. I'm going to push my hip bones straight up, leaving the chest and the ribs a bit lower. Just noticing if it's starting to feel a bit longer. Arms lift up. Strong back legs. Arms come down and roll down your spine. Right out into a neutral pelvis. Up with your left. Turn, not too many adjustments. Foot on. Maybe bring the right foot in a bit closer. See how the feeling is through the hips. And then see if you want to bring your leg up. Okay. Could be much different, easier, tighter. Back down. Looking through those other options. Up. Possibly with a leg kick. Or bent knee. Or reaching the hands behind. Okay. Taking a breath in. Or 2 or 3. If you need to stay longer, just stop the video here and just hold on to that position. 2, 1. Good. So hands off, feet down, down. And let's go back to the bridge one last time. Press, sink a little, soften a little, lift. Shoulders back. It's a great lengthener for the hip flexors, strengthening around the hips. Okay, from the back. Arms can come up. Feel that breath if it moves the diaphragm down a bit. Arms come down, roll down your spine. Okay. Now you're going to bring your feet together, knees together again, and let the knees open in what I call butterfly and back. Butterfly and back. Butterfly, so breath in on either side. Level hips. Use the muscles of the inside thigh, inside the groins as well to pull the legs in. And the same on the external rotation. And back. Okay, so we'll open the legs. We'll put the soles of the feet together. Press the soles of the feet together and down. Hands down and bridge. So not as high, but definitely a different way to do it. Much more stretch on the inside. And we'll just leave the arms on the floor. Down we come. Bring the knees back up. Stretch the legs out, see how they feel. Okay. At the front, side, or back. Take a breath in. And exhale. See if you can tuck your head and curl up part way. Maybe you want to turn over to the side, or maybe you could come the rest of the way up into sitting. Okay, so let's come around and check out a little bit of upper body rotation. Okay, from side sitting, elbow is good, high hand is good. Okay, let's turn the head, bit of the chest, reach around. Okay, having this kind of upper body curve. Okay, and maybe you feel that bottom hip. Come up out of that and open the legs a little further. Bring your hands in, see if you can turn a little bit again. So I'm turning my ribs primarily. Chest, hands down. If you have a prop, your yoga blocks, okay, you might find that that's a better support position for you. Okay. Just bend the elbows a little bit, go down, and maybe go back and forward. A little bit back, a little bit forward, a little bit back, forward. So just move in a range that's useful and comfortable. Back, forward. Okay. You may be able to walk the rest of the way around and bend toward the knee a little bit. You may be able to come toward your shin and go down a little bit. Okay, so it's kind of like pigeon, but in a slightly more folded up position. Okay, let's swing those legs around and go the other way. Okay, starting with the legs close together, high hand, turning the head, neck, and chest. Okay, so a little bit like a thread the needle, reaching the arm through. Feeling the belly pull in, taking a breath in. And then coming out of there. Okay, and then separating the legs, taking them open. Yeah. Turning the rib cage toward the thigh. Okay, hands wide. Elbows a little bit, come down somewhat. And you can repeat that, or you can do the movement a bit forward and a bit to the back. Bit forward, bit to the back, forward, back. So continue with that if it's the best place for you to be, or bring the hands to the knee. Consider a bit of a fold, or coming around to the shin and a bit of a forward. Okay. Or you could fan the whole area, right? Have the hands wide, come back, and all the way around to the front. And then up. Good. Let's bring those legs into an all fours position. Move those props for a second. Okay. Find a belly that's active, but a little dip in the lower back. Hands move forward. Okay. And I'm just going to go forward a little bit and backward a little bit. Trying not to tuck. Back a little bit. Forward. Last one. Backward. Forward. Okay, and I'm going to bring my legs in, hands in, and take my left leg back on the floor. And then turn the foot to the floor. Okay, I'll move up a little bit. Okay, so the foot is on the floor, and I'm trying to take my hand off the floor and bring it to the bone, the hip bone. Okay, so this is my good side. Okay, tuck the toes of the down foot under for more stability. Okay, so long and strong. Okay, add the arm going up. Push your foot into the floor, your knee into the floor, your hand into the floor. Think of your top arm as pressing that paddle down. And then pulling that paddle back up. You could turn your head if that works. If that throws your balance off, don't do it. Let's try one more time. Pressing that paddle down. And then back up. Good. Bring your hand to the floor and see if you can lift the leg up. And down. So a little bit of strength now. Lift and lower. If you can take your hand off the floor, good for you. One more. Lift and lower. Good. And then turn the hip. Bring the leg in. Sit back in some type of flexed position. And then we'll come up and go around to the other side. Okay, so just turn so that you can see me. Sliding the leg out. Okay, feeling strong in the belly and the upper back, so I'm not going to sink. Lifted. Turn the foot to the floor. Take the toes of the bent knee also under. Press that foot down and turn, bring the hand to the hip. Okay, so a little bit of tension in this bent knee foot, pushing the heel back. Feel the hamstrings helping out. Okay, so staying right there or reaching the arm up. And then thinking about pressing. The more you reach, my shoulder sneaks up. So keeping your shoulder down, reaching into your foot, your feet, pressing, and then pulling that paddle back up and out. You turn to the ceiling if you'd like. And inhale, reaching up, press that back foot. And pressing that paddle down. And pulling it back up. Good. Let's bring the arm to the floor. Turn the legs, hips in. And again, sit back and rest. The alternative to child's pose would simply be on your elbows, perhaps not as much on the hands, and flexing. Coming up. Okay, so coming up from there, I'm going to use the strap and the stretchy strap. Okay. And do a bit of side lying work again. Okay, so my right foot with the band, okay? I'm gonna pull it to a tension that feels like it's about a 6 or 7 out of 10. Grab your head support if you think you need it. Okay, and lie on the side. And just press that leg out long, much like you did in your all four shape, okay? And let's separate the band, actually. One hand per side, and press that away. Let the leg come down and up without disturbing your hip bones. And keep that bottom waist off the floor. Up and down, up and down. So you feel your leg in the joint, in the socket, but you don't feel the waist moving or the pelvis, just the leg. 2 and 1. Good. Let's do a few circles of the leg back and around. 2, 3. Let the direction change. Up, forward. Good. Belly, belly, belly. Always active. Try not to grip your buttock muscles. Okay, now I'm going to pull on the strap a little bit more. Bend my knee without losing the strap. Yeah, stick your tush out and press and fold. Nice and slow. Press and fold. Good. Twice again. Press and fold. Press. So on the in is just as much push into the strap. And fold. Good. Take hold of the strap. Let your leg kick forward. Bit of a swing from the hip. So flexion. Try to point your foot into the strap. Extension. Long hip. Kick. Try to push through your heel. Pull your toes apart. Point to your foot and pull back. Good. Let's do one more. Make sure the lower back is not the one folding, but your hip is folding and that your belly is active here. You're not going into your lower back to pull the leg back. And then let the leg come up. Okay. Give your hands a little bit of a rub. And push yourself up. Let's just check one thing. If you go out into that shape again and turn the leg to the floor, does that feel any different? Oop. Does that feel any different for you? Do you have greater ease or strength in any way for the hip, inside, outside, front, or back? Okay, nice reach. One of our presses down. Pull your paddle up and come down. Okay, let's do the other side. Okay, pillow if you need it. Noticing if it's easier to turn around now. Okay, strap coming to that other foot. My toes are always exposed. I've got the strap well across the middle of the foot. Down. Press out into that strap. Bring it up. Either hand. And just be cautious that it doesn't stay in front of you. And that it's actually some length in the front of your hip joint. Okay. So pulling up 6 or 7 out of 10. My bottom waist is off the floor. A bit of a lift and lower. Okay. And again, I'm not going to change my waist or move my hip bone. It's here in the groin so that the leg is moving right in the joint up. And we want to feel it in the bum, not in the front of the hip. Okay, so let's try another 4. Pull down. 3. Down. Good time to breathe in. And out. 2. And 1. Good. Okay. Circles. Up and back. Up and back. Press the strap. Create that tension. 2. 3. Go around the other way. Pull in the opposite direction. 2. 3. and 4. Good. Strap apart, press long, bend without changing your hips. Just the leg and the joint, and press, and in, fold. It's like taking a big step, right? When you dock the dragon boat and you have to step up onto the dock and you need that stability to get up out of the boat. One more time, bend and press. Good, strap can come back together and kick forward, hip flex, point the foot and pull back. Kick. Yeah, feel the bones stay in place, but the leg move, point and back. Okay, sometimes we're really good at the front, but we don't find that pull from the buttock, hamstring. The back needs lots of belly. One more time. Breath in, forward. Point back. And bend in. Strap off. Bend the hands. And then up we come. And we'll just check in with that to finish. Okay, bring yourself around. So sliding that working leg out, little dip in your lower back, lifted upper body. Slide that working leg out, turn the foot to the floor. Okay. Turn and see if there's, toes under. See if there's any greater ease, support, or strength. Arm reaches up. Good. Continue to press the foot to the floor. Press your paddle down into the water. Grab it and pull it back up. And turn to the floor. Good. Come to all fours and finish this with a bit of that pelvic tilt forward or cow posture. And tuck under. Stay in this rounded cat shape or sink back towards your child's pose. Support your head. Take 2 to 3 breaths. See how the fold at the front of the hip feels, how your lower back is feeling. Bring yourself up. Come around and roll yourself back down to a lying position. If you can leave your legs out on the floor and roll back down. The legs will relax outward, the palms will relax outward. Now let's take another breath. See how it feels through this region of the low back going into the hips. And then letting yourself nod your head, bring the legs back in. If you can curl up or turn to the side and push yourself up, either one. Coming back around to a sitting position, sitting on the floor or a sofa or a chair or an ottoman or bolster. Seeing how things feel in the sitting position. Just taking a breath in. Bringing your hands together. Thumbs to the chest, bowing the head. Thankful for the time to discover how to breathe, mobilize, and stabilize all around the hips. Thank you for taking the time to watch. Bye for now.